Hello everyone. Today we have got a very interesting topic, a topic that people are again quite surprised when we talk about diabetes in dogs. They have a history of dog is not doing well, not eating, is eating a lot, he is very lethargic, he is not able to get up and move, or he is crying all the time. And I face okay, sugar check cheddam, let us take the sugar. Kukkali kuda sugar untunda, sugar ostunda. So this is the kind of response that we get, but people are not aware that dogs and cats can get diabetes too, like human beings. As in human beings, you have type 1 diabetes. Similarly, dogs too have type 1 diabetes. Similarly, for toy dogs, their 55 mid-age or past mid-age is about 6 to 7 years of age. So it's a good idea for you to get the test done. What are the symptoms that you will see? They may be having a change in the feeding patterns. Sometimes they may not be eating at all. Sometimes they may be eating a lot and peeing a lot, urinating a lot. Sometimes they may not be having any control over the urination. This is all because of secondary infection that the diabetes can cause. How does diabetes come? What is diabetes? Diabetes is when your pancreas, the dog's pancreas don't function properly and are not producing enough insulin to assimilate, to digest and assimilate these sugars after digestion, just like in human beings. It's a very, very similar disease. It's not very different at all. So what do we do when where they come in? So we do, just like in the human beings, we do a random blood sugar test. Okay. So we take the blood, strip test, okay, and we check for the blood sugar levels. The normal blood sugar levels, that is random blood sugar levels, is very much like in human beings. It should be an average of 100 milligrams per deciliter, ranging from anywhere from 80 to about 120 is acceptable. And it's say if it's a random, and if it's a fasting, we definitely like it to be below 100. 80 to 100, becoming a little more suspicious that it could be diabetes. Why the suspicion of diabetes? Because there is something called stress hyperglycemia. Whenever there's pets are in the stress, see especially cats, their sugar levels will increase like anything, so many times it is wrongly diagnosed as diabetes. In such cases, we need to take the urine sample also. And in cats, for the stress, hyperglycemia as we call it, when we take the urine sample, there will be no sugar in that. So we know that there is a difference. But if we find sugar in the urine, we know, yeah, there is diabetes. We ask the animal to be coming in fasting, as we do for human beings, collect a fasting blood sugar and collect a fasting urine sample. And in case we find that the sugar is very high, then we start checking other things also. We check the liver function test, we check the kidney function and the urinary tract for urinary tract infections. Because as you know, with diabetes, the body's defense mechanism is very low. Sugar is a beautiful food for bacteria to grow in, and therefore secondary infections can happen. So that's why they say when people have diabetes, wounds are not healing very well. Cells that are healing require glucose are not getting enough energy and they are not able to grow well. And secondly, they also have to fight against the bacteria which have got a lovely sugary medium for them to grow. So not only are the cells weak, they are also fighting against an infection which is abnormal for the body. No defenses for the body to fight with. Oral drugs to control diabetes are not effective in dogs. They are not effective, and also they can be toxic in dogs. We admit the dog the whole day, administer insulin, and then we keep checking the blood glucose throughout the day to find out until it comes, and we put him on fluids to check to see, by the end of the day, what is the dosage that is required to control diabetes. There are situations where, it is what we call as insulin responsive diabetes and insulin non-responsive diabetes. There are different types of insulins available now. We use the same human mixture insulin in the beginning. Then there are Glargine, which is Lantus or Glargine that we can use. And there is another insulin which is veterinary specific called Vetsulin. That this is a lifelong disease. It's not something that's going to go away. Your pet, as you have diabetes, it's for life. you need to be able to manage the diabetes at home. There's a particular glucometer brand which is studied in pets. It's a human brand but also studied in pets, which is good. I advise the client to buy the glucometer. We teach the client, in fact every day the client has to come in with the pet morning and evening 2 times a day, and we collect the blood sample and we check it and we fine tune the dose of the insulin to be given. We also teach the clients how to check the sugar, how to give the injection, because it's something that they need to manage at home, just like you manage yourself. Say sugar is bad for dogs, you cannot feed sweets to dogs. No, that's not true. Your rice is as equivalent to a sweet that you are giving, because rice also is a high glycemic index food for the dog. Dog source of energy comes from protein catabolism, that is protein breakdown rather than carbohydrate breakdown. We are omnivores, they are carnivores. There is a huge difference between them. Nutrition plays an extremely important role in the lifestyle of your pet. Also, we need to check to see the liver enzymes, because the liver is put under a lot of pressure because of insulin not being there to help it digest the food. So, we need to monitor the liver by taking blood tests. We also need to monitor, of course, the kidney function tests, because dogs, just like in human beings, dogs are also prone to kidney disease, and the kidney disease can be secondary to bacterial infection. There is, because as I said, the sugary blood, wonderful media for infection, and urine is one of the places, urinary tract infection. Urine is one of the places which gets very easily infected with bacteria, and it's a very tough infection to get. So, diabetes is a very manageable disease. Only thing is people need to be aware of it, and there has to be very good client compliance for us to know how to manage it. Yeah, the most important precautions for dogs to not to get diabetes is make sure they are getting the right kind of diet and right kind of exercise. There are tailor-made foods for your dogs, with low glycemic index food. So, it is not necessary that you have to give a dog food. I am not saying that a commercial food is, but commercial foods are extremely good, delivering the right type of nutrients to the pet. It's an extremely complicated science. There is actually a very good website, balanceit.com on the website. I mean, you can go onto it. You have to feed the right type of nutrition. Pancreas have got 2 types of, one is for digestion of your fats as well as carbohydrate, and one is producing insulin. So, if there is a pancreatitis or injury to pancreas or an immune mediated reaction that sets it up, then you can get diabetes, and the cells are killed for life. So, you cannot be cured from diabetes, you can only manage it.